Hello friends, we are discussing now the Indian pharmacopoeia and complete notes on the Indian pharmacopoeia. So now start. The Indian pharmacopoeia is the official document that defines the standard of the drug manufactured and marketed in the India. It is published by the Indian Pharmacopoeial Commission under the Ministry of Health and Family Welfare Government of India. Key objective of the Indian Pharmacopoeia is to ensure the quality, identity, purity, and strength of the drug. It prescribes the standard of the drug used in the India is guideline pharmaceutical manufacturer and the healthcare professionals. The history and the milestones and the additions of the Indian Pharmacopoeia they are mentioned here. So the 1868 is the first pharmacopoeia in the India. British pharmacopoeia adapted from the India use. That is a 1946 Indian Pharmacopoeial Committee is formed under the chairmanship of Colonel R.N. Chopra, and the 1955 is the first Indian Pharmacopoeia. It is launched in IP 1955 and by the chairman is Dr. B.N. Ghosh, and the editor and the R.N. Chopra is the chairman, and its color is orange. And the second edition of IP is launched in 1966. In the color is green, and the 1985 is the third edition. Color is blue. 1996 fourth edition. Color is red, and 2007 it is a fifth edition of IP established at Ghaziabad. Maroon color, and the 2010 is sixth edition by the Dr. Jian Singh, Secretary cum Scientist Director, and its color is light blue. 2024 seventh edition purple color. 2018 eighth edition violet color, and 2020 it is the last edition now. Recent edition ninth edition IPC under the Ministry of Health and Family Welfare sky blue color. Component of IPR general notices, general chapter, method, testing, apparatus, etc. Monograph for the drug, dosage form, vaccine, radiopharmaceuticals, appendices, weight measure, reagent preparation, reference standards, standards of Ayurveda, Unani, herbal drugs, inclusion started in the recent edition. Key organization involved is Indian Pharmacopoeial Commission, Ghaziabad, Ministry of Health and Family Welfare, and Central Drug Standard Control Organization, that is CDSCO, which is a regulatory body of India, works in a tandem with the IP standards. ICH guideline for the Indian Pharmacopoeia are the IP also harmonize some testing procedure with ICH guideline for the established stability testing, analytical validation, and impurity. ICH guideline Q1 to Q10 topics are relevant to the modern IP standards. International cooperation is emphasized for the improving the drug quality globally. Now the importance of pharmacists, essential reference of the drug formulation, manufacturing, quality control, and regulatory affairs use pharmacists, QA and QC officers, and regulatory help in the preparing for the drug inspector, GPET, MIDC hospitals, pharmacy exams. Now we are discussing the 5 MCQ on it from the above topic. Which year was the first Indian pharmacopoeia is published? That is option B is correct, 1955. And the second question is the Indian pharmacopoeia is published by which organization? That is IPC, the Indian Pharmacopoeial Commission. Option C is correct. And question 3 is what is the color of the third edition of IP 1985? That is option C is color, that is blue color. And fourth is who was the first chairman of the IP committee? That is Aryan Chopra is the first chairman, under which the BN Ghosh declared the first Indian pharmacopoeia. Fifth question is what is the headquarter of the Indian Pharmacopoeia Commission? That is it is option C, that is Ghaziabad. Thank you friends.